My name is Jaden Ibanez and I go to Maui Intermediate. We're at the Maui STEMworks How to Save a Life workshop at the Maui Memorial Medical Center. So the stations I've been to are the CPR workshop, the AED one, and the Stop the Bleed. At the CPR workshop, we practiced CPR on dummies, and at the AED one, we were able to practice using defibrillators and CPR, so combining the two skills. And at the Stop the Bleed workshop, we were able to practice on a dummy leg and practice packing, pressure, and using tourniquets to stop fatal bleeding. And also the last workshop we had was the stroke, and it talks about the two different types of strokes and how to recognize signs.
So aloha, my name is Cameron Rogers. I am a Trauma, Injury Prevention, and Outreach Coordinator is my official title. I do education both at the hospital for nursing and nursing staff to care for traumatically injured patients, but I also do community outreach to teach folks in the community how to prevent traumatic injuries from happening in the first place. Elaine Passion from STEMworks is really, she reached out to me. She was looking for Stop the Bleed training, which is one of the programs, the community outreach program we do as a trauma center. A lot of folks don't know that we're a trauma center here, which is a really great thing for the community. It involves not just community outreach, we also have 24-hour access to neurosurgeons, trauma surgeons, and this results in really good care for our patients. And so she reached out to me because we do Stop the Bleed education in the community, which goes over how to identify life-threatening blood loss and how to stop it. And she wanted that for her students. What I do is look at our data of traumatically injured patients and look for trends to see who is getting hurt and how they're getting hurt, and then try to stop those injuries from happening. And when we look further at the data, it's our youngest drivers that are most at risk. And so we have brought 2 programs to the community in the last year to address those 2 issues.
I think the most important thing I've learned today is how to make good choices. So we talked about what the leading cause of death is for teens, and I totally wasn't expecting that it was car crashes. That's coming up soon, we're all gonna start driving soon, and it's really important that we make good choices for our future. Some of the ways that they said you could prevent having an accident like that, it's really simple things like turning down the music, following the speed limit, just something as simple as buckling up your seatbelt. In one of the crashes, if he had just buckled his seatbelt, he would have survived. So those are definitely some important things, just the basic things.
You know, we hope that they took the message home of safe driving. Charlene Brown, who lost her daughter Hannah, just started joining us this year, and it's been so impactful having her and Hannah come and share their story. So I'm so thankful for her and Hannah for coming for that. So hopefully that really was impactful for them, and they take that message home to their families and are safe drivers and carry that message forward. And then hopefully the trauma demonstration, I think that had a lot of shock factor to it. But hopefully it really just showed, again, I know these are science kids, and we wanted to show them, you know, there's a lot of cool gadgets out there and all these other science worlds, but we in healthcare really do work with all these cool gadgets. And you know, I told them before we did that we really are the engineers, architects, and coders of the human body. There's so many people in healthcare that work so hard, and it was really nice to give them some light. So having respiratory therapists come up afterwards, he was hilarious. I loved his talk. And then having imaging come up. And then of course having our volunteers come up and talk about how that's something that the hospital is really wanting to grow, is getting the youth more involved, having young people come who are interested in health, come here and be involved, so that hopefully they come and work for us one day.
Aloha, my name is Jennifer Suzuki and I'm from Maui Intermediate. So I think anytime we can get the kids out of the classroom and have them do authentic activities, I think that's super important. It gives them a glimpse into what their future could be. The opportunities that are available here on Maui, because of course we want them to stay here, and it gives them a hope for the future. I really like this one a lot because it showed the variety of different jobs that are available instead of just doctor and nurse. So I thought that was powerful, because I can see a lot of the kids not wanting to go to school for 12 years, but for 2 years that's totally possible. And I think it's super important for our kids to have those opportunities. I think that's where they learn more than, I don't think a worksheet's ever going to do what something like this did for them. It builds some confidence too, right? You know, they don't always see themselves in this kind of profession, and then when they come here they're like, hey, that guy looks like me, or I could do this. Then that just opens doors.
I hope I never have to use the skills that I've learned today, but emergencies, accidents happen anywhere. So hopefully in an emergency situation, I'll be able to apply the knowledge I learned today and hopefully save a life.